always have to move. Always move, because if you stay here, you will burn the patient. With this handpiece,
we need to use this one, right?
always, always. Also with that handpiece. With that handpiece here, can I just for a second? The electricity will go like this, around and around and around. So this means that in the geometric center, or there where there's a lot of injury, the energy will be concentrated. Okay? So that means that if I'm working, for example, on the shoulder here, I can work on the inert structures meaning that there's no blood in these structures. There's bone, tendon, ligaments, or myofascia. Okay? I use this. Muscle.
What's myofascia?
Myofascia is the connective tissue around the muscles and inside the muscles. Okay, this we use for blood rich. So skin, lymphatic system, and muscle injury. Okay? So this means that when I'm working with this handpiece, I can stay on the same space. So I'm going to be using this mainly on joints. Yeah? Joints I can leave here and I can do mobilizations while I'm working. In fact, combining this handpiece with movement, yeah, is very, very good. Yeah? I always combine it with movement. If I'm working on the shoulder, sometimes I will put the plate here in the back, yeah, and I will put the handpiece in the patient's hand, and I will work on the shoulder here. Yeah? Okay? Okay. Sometimes for a knee, I will put the patient's foot on the plate, and I will put the handpiece on the knee. Yeah? It depends what kind of configuration we want. Okay, so now I will kind of demonstrate how to structure your treatment. We always structure the treatment in 3 phases. In fact, 4 phases. First we have a warm-up phase, then we have the passive phase of the treatment, and then we have the active treatment phase, and then we have the cool down. So warm-up I always do with the capacitive mode in order to warm up the tissues, to warm up the periphery. I create a vasodilatation, more blood flow. Then I use my passive treatment, no heat or sometimes heat depending on which phase we are, but in acute pain, no heat. In chronic, we do heat. Then we have the active phase of the therapy. We use this and we combine this with movement. Okay? Okay. Then we have the cool down. After having moved the joint, we have to cool down the area, and we can use now or a capacitive or resistive mode in order to cool down the tissues. Yeah? Okay. So sit down, and I will kind of treat his knee. Okay? Okay, a very important advantage of the TCare is that you have the roll-on handpieces. The roll-on handpieces, they contain cream. They contain cream, a thin layer, so you have minimum waste of cream. With other systems, you have to lose a lot of cream all the time. So we have minimum waste of cream. Yeah. Another thing that we can do is we can put something inside. You can put something inside, like for example NSAIDs or diclofenac, yeah, in order to reduce the inflammation. Yeah, we can put medication